When people think of the world's deadliest diseases, they probably think of the fast-acting, incurable diseases that make the news every now and then. However, many of these diseases do not rank among the top 10 causes of death worldwide. Even more surprising is the fact that several of the deadliest diseases can be prevented in some cases. Where a person lives, access to preventative care, and the quality of health care are all non-preventable factors. All of these things contribute to risk. However, there are steps that anyone can take to reduce their risk. These are the top 10 deadly diseases killing people around the world as we speak of right now. Number 10. Cerebrovascular disease. Also known as brain attack, a stroke occurs when the brain's blood supply is deprived of oxygen, causing serious damage. Every year, around 6 million individuals worldwide die as a result of this disease. Weakness in bodily parts, loss of balance, and vision impairment are all common indicators of a stroke, though they vary depending on the subtype of stroke. While many people have survived strokes with relatively minor disabilities, others have not been so lucky and have died within minutes of the attack. Number 9. Methicillin-resistant Staphylococcus aureus. MRSA is a bacteria that is resistant to the antibiotic methicillin. This bacterium, dubbed a superbug, has health specialists scratching their heads. It's also known as oxacillin-resistant Staphylococcus aureus, or ORSA, and it's the source of a variety of infections in our bodies. Because it's resistant to some medicines, it's extremely tough to cure. It can enter the body through the nose and cuts, and the consequences of its presence can be fatal. It begins as a minor skin infection that is usually treatable. Some types of community-associated MRSA, on the other hand, can cause serious illness and even death. Number 8. Rabies. People contract rabies every year after being bitten by wild animals, which is why it's crucial not to be too familiar with them. While there are therapies available to help you recover, when it comes to rabies infections, time is not on your side. Incubation can last anything from a week to a year. However, once symptoms appear and the virus has reached the neural system, a person might die in less than 10 days, suffering from hallucinations, paralysis, sleeplessness, and delirium until death. Number 7. Chagas disease. Triatomine insects, usually known as kissing bugs, transmit this parasitic illness. These critters enjoy defecating near bite wounds as they roam the streets at night for human prey. If the pests are infected with Trypanosoma cruzi parasites, which are expelled with their feces, this might turn into a severe infection. Notably, the sickness has several stages, each of which can be fatal. Number 6. Meningococcal disease. Meningococcal disease is spread through saliva and occasionally through extremely close and prolonged contact with someone who has the disease. The condition, which is caused by the bacterium for which it is called, can cause symptoms such as nausea, vomiting, and joint pain, though these are primarily dependent on the type of infection obtained. Even if the infected person has taken antibiotics, meningococcal disease can progress to meningococcal meningitis, which can lead to death. Number 5. Dengue fever. Dengue fever is a mosquito-borne disease carried by the Aedes aegypti mosquito, which is endemic to the tropics and subtropics and is found in over 110 countries. The virus is usually not fatal, and the first symptoms are similar to the flu, such as high fever and headaches, so a healthy person can recover in approximately a week. However, for certain people, it might progress to severe dengue hemorrhagic fever or dengue shock syndrome, which can be fatal. Number 4. Necrotizing fasciitis. Also known as the flesh-eating bacteria sickness, fasciitis is a bacterial illness that may spread like wildfire throughout the body. It is usually caused by organisms that already reside on our bodies, and it rarely spreads by physical touch. Although it is a rare skin infection, it can be treated with antibiotics and the prompt removal of the affected tissue using common sense. However, if the germs are so deeply embedded in the tissue that early indicators aren't visible and the infection isn't treated promptly, death will arrive on one's doorstep in no time. Number 3. Bubonic plague. The bubonic plague, which is said to have been the source of the Black Death, is thought to have killed roughly 50 million people throughout medieval times. It's difficult to envision another disaster, but it's even more astonishing to learn that the flea is a main source of the bacterium that causes the plague. The patient's lymph nodes are compromised after being bitten by an infected flea. The infection can spread to the blood, which is known as septicemic plague, or to the lungs, which is known as pneumonic plague, and both can be fatal. Bubonic plague symptoms can show within a week of exposure, and if antibiotics and proper care are not given, an infected person can die within 24 hours. Number 2. Cholera. Cholera can be contracted in areas with inadequate sanitation, which means that food and water are more likely to be contaminated by human feces containing the bacterium Vibrio cholerae. A cholera infection, if left untreated, can cause excruciatingly painful symptoms, beginning with watery diarrhea. It can also include leg cramps, vomiting, and shock, but severe diarrhea can cause severe dehydration in as little as 2 hours after infection. The person can then die in a matter of hours due to a lack of treatment. Cholera is known as the blue death because dehydration can cause bluish skin. Number 1. Ebola virus infection. Ebola viruses generate this viral hemorrhagic fever, which has a 50% mortality rate on average, while the risk of death can range from 25% to 90% of individuals who catch it. Ebola symptoms appear with a fever between 2 and 3 weeks after exposure and are spread through bodily fluids and anything that may come into touch with bodily fluids. As of 2016, there are no vaccinations available to combat Ebola, and the virus's most recent outbreak occurred just a few years ago. The West African pandemic, which began in late 2013, claimed the lives of 11,315 people. So guys, that was it for this video. What did you think about our video? Let us know in the comment section below. If you are new to our channel, be sure to subscribe and ring that notification bell to get notified about our latest videos. Thank you for watching.